The Natural History Study of Rare Solid Tumors is a longitudinal, observational study coordinated by the National Cancer Institute's My Pediatric and Adult Rare Tumor Network, known as MyPART. Anyone with a rare solid tumor is encouraged to enroll, especially children, teens, and young adults. This study follows people with rare tumors over time to learn about how rare tumors grow and develop with the aims of determining why rare tumors form and finding new treatments. Study participants are asked to provide a saliva sample and allow access to medical records, imaging scans, and any tumor tissue that may be available from previous biopsies or surgery. Participants are also asked to complete questionnaires and surveys about their lifestyle and their family's medical history. Since the Natural History Study of Rare Solid Tumors began enrollment in January 2019, over 400 people have joined the study. The MyPART network has also grown to include 19 rare tumor advocacy organization partners. The MyPART network is a group of doctors, researchers, patients, families, and advocates with a patient-centered approach to finding treatments and working together to improve the lives of people with rare tumors. As the Natural History Study of Rare Solid Tumors approaches its third anniversary of opening enrollment, we're looking back at all that we've accomplished and looking forward to what we hope to achieve in the future.
Rare tumors across the world are lacking in knowledge, resources, and community. Over the last 3 years since opening enrollment on the Natural History Study, we have started to scratch the surface on increasing the knowledge, resources, and very importantly, helping to develop a community for those with rare solid tumors. Our hope for the future is to continue to provide as much as we are able to for patients with rare tumors. We want to continue to increase collaborations across the whole world as progress cannot be made alone. Together, we want to increase the collective data to better understand the tumor biology and natural history, which will then lead to the ultimate goal of new clinical trials for rare solid tumors. Finally, we continue to strive to be a source for those with rare tumors to guide them to a community that understands the struggles they are undergoing.
I think in the last 3 years, we've been able to begin to amass enough data to start to think about some of these rare solid tumors. So for instance, chordoma is a very rare solid tumor that we really didn't know a tremendous amount before. And I think the first step in trying to develop new ways of treating people and better ways of treating people with some of these rare tumors is just to understand very basic information about them. Who gets these kind of tumors? How do they do over a span of time when they have these tumors? What things have people tried that have been successful in taking care of people with rare tumors? So I think that's been pretty successful. The things that make the NIH Clinical Center unique are the things that make the study unique. We have the ability to reach out to patients across the United States and even across the world, and to be able to collect information from those patients, to be able to have the time to talk with those patients, to be able to incorporate things like patient-reported outcomes, how the patients are really doing in their real life into a study like this. I think that makes it unique.
For each individual patient, we will analyze the genes that are in your tumor and possibly within your whole body to tell us if there are any targetable changes, meaning any medicines that we can use that can be specific for the genes altered in your tumor. We also provide second opinions and treatment recommendations for patients. All of the services provided to patients, whether participating at home or at the NIH, are at minimal to no cost to the patient. For the research community, all the data collected on this study will become publicly available. Without our patient and advocacy partners, we would not be as far along as we are, and we are very grateful for this partnership and look forward to expanding them.
So there are a lot of important outcomes that this study could help enable. It's a great opportunity for patients to make an impact in the understanding of this disease and to help advance research. It's a great opportunity for researchers to learn from the experience of every patient. And it's frankly a great example of the research community coming together researchers and physicians across multiple institutions coming together to answer a question that none of them are in a position to answer themselves. And so we're just thrilled to be able to partner with the National Cancer Institute and with all of the researchers and investigators across the country and across the world, for that matter, who are helping to make this study possible.
The progress of the MyPART network and the natural history study of rare solid tumors would not be possible without our patients and their families.
So, hi, my name is Faith Ann Hill. I am 19 years old. I'll be 20 in January. I have ASPS, which is alveolar soft fat sarcoma. I've had it for about 10 years now. I was first diagnosed when I was 9 years old. I live in Trinidad and Tobago. It's a very cute little island in the West Indies. And I was treated here for a while. I sent my research papers and all the files and records from doctors to NIH, and then I started a trial with them. And I've been with NIH for the past 10 years doing different trial drugs and that kind of stuff. It's a very lonely condition, especially to have, because a lot of people don't have ASPS, especially young people my age. It's almost unheard of. Especially in Trinidad, we have this very small island, being able to share that and give somebody else, I don't know how much years from now, hopefully they see this video, that they could do it as well. It's great. It's amazing. I'm happy. I decided to take part in the study because I wanted to help. The fact that they could get more information about this very rare and strange tumor, and it could maybe help somebody in 10 years. I just thought about all the other kids who would be put in a situation like mine, where it felt as though nobody knew anything. And then somebody reached out and said, I actually know something. Maybe I can help you. If my tumor, if the little sample that you got from me could do that for somebody else, could give them that hope and change, I jumped at it. I was happy to be able to be a part of that.
So I'm Katelyn Lee. I'm 18, and at the moment I'm going to the University of Louisiana at Lafayette, studying visual arts, and I'm a freshman. I was diagnosed with cancer at the age of 13 in 2016. For years, I had noticed a lymph node that had been growing on the side of my neck. Along with that, there had been numerous times where I'd gotten sick. I was referred to an ENT and was prompted to have a biopsy of the lymph node. After that biopsy, I received a diagnosis of the rare form of cancer called MEN2B and was urged to meet with a surgeon at the Children's Hospital in New Orleans. Initially, my surgeon had proposed that I had a prognosis of 5 years. Fortunately, in my case, I had an effective treatment of a 12-hour operation to remove the tumor. The surgery also involved the reconstruction of my trachea, which also caused me to have a tracheostomy and a total thyroidectomy and parathyroidectomy. After having the surgery, I started long recovery in the hospital. The hardest part for me was having to not be able to go to school. It has now been 5 years from 2016, and I'm thankful for the research that has helped to save my life. Well, I decided to participate in the study because I knew that I would have gained knowledge of MEN2B. I also wanted a way that would have made it easier for me to explain the type of cancer that I have to my family and friends. The adverse effects of MEN2B or MEN that affect me can provide a more clear outlook on rare tumors for doctors researching those tumors and for patients who are hoping to understand their diseases in a more substantial way. Ever since I got involved in cancer research, I stopped resenting the fact that I have cancer, because along with the others dealing with the same circumstances as me, I know that I will never not have a major role in the ever-changing discoveries that make breakthroughs in cancer research. All in all, the opportunity of having a part in cancer research has given me hope towards a healthy future in which I find a way to pursue my ambitions without letting cancer overcome me.
What does our research progress look like? In the past 3 years since the study opened, we have over 400 people enrolled in the study, representing over 50 different rare tumor histologies. We exchange information and resources with 19 rare tumor advocacy organizations who are MyPART partners. We've processed over 1,800 biospecimen aliquots, created 16 new data entry forms, developed 12 new rare tumor patient-derived xenograft or PDX models, launched 5 new interventional trials as part of the collaboration with the National Cancer Institute's Developmental Therapeutics Clinic, opened 3 new tumor-specific subprotocols of the natural history study, and established 2 new rare tumor clinics at the NIH Clinical Center.
As a postbaccalaureate for MyPART and the daughter of a metastatic cancer patient, I am passionate about using my personal caregiving experience to help navigate patients and their loved ones every step of the way on their rare cancer journey.
To everyone involved, all the people who have worked on it, all the patients who have put up with our questionnaires and our phone calls, is that you're really making a big difference. And hopefully all of the work that people have put in and all of the time and all of the altruistic input from our patients and the patient advocacy groups will really help make a difference over time.
We truly appreciate all those that are currently participating and those that will join in the future. We are so sorry for all of your struggles with your rare tumor, and our team strives to help in any way that we can. We thank you for your willingness to partner with us to make a difference in the lives of those with rare tumors, including your own.
We're looking forward to the future of the natural history study of rare solid tumors and continued collaboration with the rare tumor research community to accelerate advancements in rare solid tumor treatments and interventions. Most importantly, we look forward to continuing to work closely with our patients, without whom advancements in clinical research would not be possible. Thank you to our patients and families. To learn more about MyPART, visit our website at cancer.gov/MyPART. To stay up to date about MyPART and the natural history study of rare solid tumors, subscribe to our monthly newsletter, the MyPART Minute, and follow us on Twitter at NCI_CCR_PEDOnc.
U.S. Department of Health and Human Services, National Institutes of Health, National Cancer Institute, cancer.gov, 1-800-4-CANCER.